Okay, let's see the variants of atrial extrasystoles. The morphology, the form, the shape of the premature atrial contraction may be different in the same strip. And this is usually due to a conduction through the AV conduction, through the AV node. Let's see this figure here, figure 8a. As you can see, we have here a normal sinus rhythm, as indicated by these beats here, interrupted on two occasions by a premature beat. Here's one, here's the other. Now notice that in this lead 2, the form, the morphology, the form, the way it looks like of the QRS of this premature beat and this one preceding is different. It shows here almost a normality. If you compare this QRS to this QRS, they seem almost identical. And also the P wave, it's very similar in form and size to the preceding normal P wave. Whereas in this beat here, the QRS is dilated and the P wave shape and size is definitely larger and taller than this P wave. Now if we then look, if we take a picture from V1 or V3R, then we can see that the morphology of the QRS is of the type of right bundle branch block, RBB type. Why is that? Because the delay of the premature beat being so early finds the right bundle still in the refractory period, and therefore is delayed. The conduction is delayed. It can be delayed totally with a complete right bundle branch block, or partially delayed with an incomplete right bundle branch block, which is detected by the width of the QRS complex. So this is another example here on figure 8b. Figure 8b. Again, we see a normal sinus rhythm indicated by these three beats. Then a larger P wave, P prime wave, we should say, compared to this P wave, and a QRS complex, which is widened, indicating again a conduction, intraventricular conduction delay. Okay, so remember that the right bundle has the longest repolarization time of the entire AV conduction system. So when you have a premature impulse coming from the atrial or anywhere above the His bundle, it may show an aberrant ventricular conduction of the right bundle branch block type, complete or incomplete. So this is important. And it's important also identifying the presence of a P prime, okay, like we see in this here, this the P prime, which is a P wave, which is not, doesn't look like a sinus P wave, but some sort of an abnormal P wave. That's why we call it P prime, followed by a widened QRS complex. And this helps in differentiating a premature atrial contraction with an aberrant ventricular contraction from a regular garden variety ventricular extrasystoles.